Good evening. My name is Ana Soto, and I will be presenting the project Impact of the COVID-19 Pandemic and Previous Natural Disasters on the Mental Health of Healthcare Workers in Puerto Rico. The COVID pandemic has strained healthcare systems worldwide, including healthcare workers. Research has identified this population as at risk of mental health problems, but research has also pointed out that protective factors such as resilience often emerge in the context of disasters. However, most of this work is from China and does not examine other contexts such as the Caribbean, where healthcare workers who have been previously exposed to multiple disasters often face additional challenges. Puerto Rico, an archipelago located in the Caribbean where most of its citizens speak Spanish, is a non-incorporated territory of the US. And during the last decade, Puerto Rico has experienced multiple waves of natural and social disasters, including an economic recession and bankruptcy, the imposition of austerity measures, two major hurricanes, Irma and Maria, that caused a major humanitarian crisis, the ousting of the governor due to a corruption scandal and the mismanagement of the aftermath of hurricanes, and a swarm of earthquakes in the southwestern region of the main island. It is within this context that the ongoing COVID-19 pandemic unfolded, exacerbating an unstable social and political landscape, leading some research to posit that the threat to Puerto Rico during the pandemic lies principally in this context. This impact has resulted in an increased migration of healthcare workers as well as higher mental health problems following the previously mentioned disasters. However, although research has examined community resilience in Puerto Rico, individual resilience among healthcare workers during the COVID-19 pandemic in Puerto Rico is yet to be examined. Thus, our objective was to examine the impact of the COVID-19 pandemic and previous exposure to natural disasters on the mental health and well-being of healthcare workers in Puerto Rico. We conducted a cross-sectional design as part of a larger international study. Data was collected using an online survey technique during the first peak of the pandemic between June 2020 and October 2020. We used descriptive statistics, chi-square, and logistic regressions to analyze the data. Most participants responded that having experienced the impact of Hurricane Maria and the 2020 earthquake made coping with their emotions during the COVID-19 pandemic somewhat too much more challenging. No association was found between age and gender with depressive symptomatology. Significant associations were found between residence location and depressive symptomatology. A significant association was also found between resilience and depressive symptomatology. And as you can see in the second table, our team found those who reported being highly worried about getting infected or infected their families had more odds of having depressive symptoms than those who did not. Participants with a probable or confirmed case of COVID-19 exposure had twice the odds of having depressive symptoms compared with those who didn't. After controlling for resilience and residence location, participants who reported being highly worried about getting infected had almost twice the odds of depressive symptoms than those who reported not having or having low worry. After controlling for resilience and residence location, the odds of having depressive symptomatology were almost 5 times higher among those who reported higher emotional coping difficulties during the pandemic after experiencing a natural disaster compared to those that did not. To conclude, despite high levels of resilience, healthcare workers who reported emotional coping difficulties because of previous disasters had almost 5 times the odds of developing depressive symptomatology. One potential explanation might be the resilience paradox, which suggests that more resilience might lead to more vulnerability in some contexts, as it can reduce negative emotional responses to disasters and translate into less motivation and inducement to tolerate disparity and inequality. This might be true in a context such as Puerto Rico, where social and political crises and natural disasters have been continuously occurring. However, more research is needed to understand better the role of this phenomenon that might be related to the mental health and well-being of healthcare workers within the social, political, and cultural context of Puerto Rico. Thank you for your attention.